The presentation today will be by Dr. Mohamed Elriedy. He is a consultant of anesthesia in the UK. His talk will be about the effective feedback. As said in the first lecture by Dr. Ahmed Abdelati, the process of communication starts with the listening and understanding and reply in order to give good communication. So feedback is also essential, especially in the medical field, because we have many different cultures coming from either doctors or staff members, nurses, also the patients and their relatives. Sometimes we have to break bad news or tell something that patient case is terminal, something like that. So we need to be sure we have feedback in the knowledge that we are sharing, we are understanding, we are processing. So now we'll start with Dr. Mohamed Elriedy. Please, you can start.
Thank you very much for Dr. Mahdi for inviting me today. I'm really glad to be tonight. Again, I'm really honored to be within the very great presenters tonight. So effective feedback. So if we're going to talk about effective feedback, it is an endless topic. It is a big, massive topic. And tonight, I can't cover it all. I can speak about it for a week and still hasn't covered it all. So what I'm going to try to do tonight is that give you the keywords, give you the basics, try to put some fundamental kind of structures so that you can build on it and explore further. Why it is important, in my opinion, it is one of the most important topics in medical education, if not the most important. During our professional, personal lives, we all receive feedbacks and we all give feedbacks. And I remember back in 2010 when I came to the UK, during my first interview ever for a job in the UK, I did well in the interview, but still I could have done better. So I asked afterwards, for a feedback. I got the job, so I was glad about that, but I wanted to know what I can do better. So I had really very constructive feedback, and that changes. So through, starting with my job, I used that feedback and I carried on building on it, and also carried on building with the feedback I received. Through my training, by the end of it, I was asking for feedback, and what I was getting, well done, good job. You've at the end of your training. So very general feedback, nothing specific, nothing to help me to actually start as a consultant, as a new consultant. What do I need to do? Where to start? So nothing very helpful, and that actually triggered me thinking, about how important that, and we need to reinforce this message about feedback and how important it is. If you look at the literature, there are thousands of publications about feedback, but the boom happened between 2010 and 2020, and it just carrying on. And the reason is it's been highlighted in the medical education field that actually the core of education is the feedback. So tonight we're going to talk about, again, why it is important. And in order to understand why it is important to us to be able to receive a feedback and deliver feedback, we need to understand about how actually we learn. And also we're going to talk about social styles, because it is very important to understand that we are different. And the way we receive communication, the way we deliver communication is different according to our social style. And we need to understand that social style kind of topic, big, massive topic, which I'm not planning to cover again tonight. I'll just give you the kind of the pillars of it. It is very important to understand your social style type, understand yourself, so you can understand others. Then we're going to indulge into the feedback, more technical details about definitions, about feedback definitions, some other terms as well. We're going to classify feedback, and we're going to look at some models, how to deliver feedback. And lastly, we're going to go through some do's and don'ts regarding delivering feedback. This is Atul Gawande. You may have heard about him. He's a surgeon in the States. One of his famous books is called the Checklist Manifesto, which is talking about WO checklist. I would recommend you to read it. It's one of very, very good books that I've read through my professional career. He did something which is very actually courageous, and I don't think the surgeons, all the surgeons have that much courage to do what he did. He brought in his theatre a coach, so another colleague, another surgical colleague. Bear in mind that he's a senior consultant, so he brought in another senior consultant, and he actually, paid him to be able to watch him performing his surgery and giving him feedback afterwards. What he says is that no matter how well trained people are, few can sustain their best performance on their own. And actually, I would say no one can sustain their best performance on their own. Everyone needs coaching at some point. Everyone needs feedback at some point. And the reason is, in 1984, Kolb's published a theory about how we learn, and it's called the exponential learning theory. So basically, in my opinion, actually that has been going on since the start of mankind on Earth. What Kolb described is a cycle where we do something, do an action, then think about the action we've done, reflect on it, and see if we can do it better. And we try again, doing it the new way we think it will work better, and then see if that has actually improved the outcome, and carries on like that until we reach the peak of our performance. And that we've been doing this, as I said, since the start of mankind. Think about yourself, when you start to tie your shoelaces. You were faced with a problem when your father or mother brought you the first shoe with laces, and then you didn't know what to do with it. They taught you how to tie your shoelace, and then you actually got better over time by reflecting on it, by learning more how to do it, until you became competent and actually expert in tying shoelaces. At least most of us are. So where feedback comes here, feedback augments the reflective process, augments the reflective observation. It helps you to identify areas you can actually improve, and guide you and coach you towards improving your performance. Joseph Loft and Harrington Ingham in 1955 came up with this model. It's called the Johari Window model. So basically, they wanted to describe how we interact physically, how we interact emotionally with others. So they described 4 boxes, and all of us will be in one of these boxes at a certain situation. And all of us have experienced being in one of these boxes. So the first box here, this is something that it is known to self and known to others. By that I mean is that when you do some action, when you express emotions, you know why you're expressing it, you know how you're expressing it, and the others are receiving the same message. They are seeing the things that you are seeing. You both have an insight of what's happening. In here, in this box, where it is known to yourself, but not known to others, so basically your actions, your emotions, the one that you're expressing, you know why you're doing them, but the others do not understand why you're doing them. You don't know the reason behind it. There's no communication. You're hiding it from the others. This box, it is the worst, where you're actually doing something, but you don't know why you're doing it, and you don't know the emotions you're experiencing, as well as the others. They can't see that. There's no communication. And what the feedback will try to do is actually help you with this spot here, because as a feedback giver, you will be able to see something which is not known to the one who is actually requesting the feedback. And with your ability to provide the feedback, you will be able to help him or her to find out what this blind spot and improve on it and get it better. And that takes us to actually the Gordon Training International 1977. described a model of how we gain competencies. So we start, as we said, for example, tying the shoelaces with something that we don't know how to do. Have never tied the shoelaces before, and I now have a problem. Okay, so you are unconscious incompetent because you don't know that you actually have to tie the shoelace. And then when you're being presented with that shoe, now you need to learn how to tie your shoelaces. So your parents start to teach you, you start to teach yourself. So you become unconscious incompetence or incompetent, because there will be a learning curve until you can actually tie your shoelace. When you're able to tie your shoelace, you achieve the competency, but still you need a bit of focus, you need a bit of effort to do it. You need to look at it while you're doing it. After some time, after some experience, you will do it blindfolded and you are shifted to the unconscious competence. So the idea of the feedback is to help us through this cycle, to guide us through this cycle. From each box, going from unconscious incompetence to unconscious competence, we need feedback. And that takes us to actually the social styles. It is important to understand that we are different. I'm not going to talk about social styles in depth, but I wanted to tell you about the importance of social styles. We are different in terms of how we communicate. We are different in terms of how we perceive communication. For example, all of us will be on the spectrum of these 4 boxes. I am here. I'm in that green spectrum here. So I'm assertive, and I'm kind of people person. So when you talk to me, you need to give me some time. You need to give me some time to process. When I talk, I can talk about a lot of opinions. Okay. I'm people focused, so the people will concern me. Okay. And I give reasons, then state recommendations. My opposite kind of person in the spectrum is the red spectrum, who's task oriented and tell assertive. So when we try to communicate, if I don't understand that the person who's in front of me is in that spectrum, I'm going to perceive him or her as rude. I'm going to shut down. I'm not going to listen to them. And the opposite happens. If I start to speak to someone who is in red and not understanding they are in that red spectrum, the same will happen, because they will perceive me as he's talking nonsense. He doesn't know what's happening. So we need to understand that we are different, and that should tailor how we deliver the feedback, and also should determine how we accept the feedback. So this is all about the importance of feedback and why we need to understand its importance and the importance of actually where it fits into our learning process. So going more technical, so let's go through some definitions. So feedback, according to the Merriam-Webster dictionary, is the transmission of evaluative or corrective information about an action, event, or process to the original or controlling source. And it is important to understand it is all about the controlling source. That means it is the learners. The learner is the controlling source. It is about the learner. It is learner-centered. It is not about teacher. It is not educator-centered. So your feedback has to be tailored to the learner. What's the difference between feedback, debrief, coaching, mentorship, and evaluation? In order to understand the differences between feedback and these other terms, we need to look at the components of the feedback. The first part of the feedback, or when you are delivering a feedback, you need to look at what the feedback requester is doing. You need to agree with him or her on that, what you are going to observe. You need to observe something happening. Then, after observing it, you need to evaluate the performance. In order to evaluate the performance, you have to have objective assessment. method of doing that. It can't be your opinion. It can't be subjective. You have to be objective in order to be received as a constructive feedback, which we're going to explain in the next few minutes. After you deliver your evaluation, you start your guidance. You start your opinion about how to move forward, how to get better with your feedback. And that is coaching. And that helps the learner to go further ahead and improve on their performance. And lastly, you need to facilitate that kind of process of improvement by giving them support all through. So these are the components of feedback. So evaluation is a component of feedback as well as coaching. So what's the difference between coaching and mentorship? The difference is mainly about the targets. So coaching is mainly about 5 very focused targets, like, for example, doing a cannula or inserting a cannula. Mentorship is about more generalized targets, about what I'm going to do to have a better work-life balance, what I'm going to do to be able to finish this project in terms of my personal life, professional life. So it's more about generalized targets. And that determines actually the time scale. So for coaching, it is about short-term objectives. And for mentorship, it is long-term objectives. So mentorship will look at a longer time scale. Lastly, the difference between feedback and debrief is actually not much. So feedback and debrief, it can be used the same, but debrief has been associated more with giving a debrief about a clinical situation, an emergency situation, either it is real or simulated. And there are 2 types of debrief, the immediate debrief or the hot debrief, we call it, and the delayed debrief. The difference is that with the hot debrief, you are trying to acknowledge the emotions of the team. You are trying to acknowledge emotions of the people who have been involved in the situation, and also to answer any the questions or any concerns they have. And then the delayed debrief, we come back again, we evaluate the situation, and we have a constructive discussion about it so we can improve the next time. How we classify feedback. There are loads of ways to classify feedback. The first one is about the process of feedback. So if it is formal or informal process, which is straightforward. The purpose of feedback, it is either it is constructive, that means it is task-focused feedback that aims at building and improving the learning experience. And sometimes we call it facilitative feedback. Is it inspiring feedback aims at motivating the learner, motivating the feedback receiver to improve, to optimize their performance, to have more self-confidence, to achieve their potentials? Or it is corrective or directive feedback, which is very short, frequent, very task-focused, and it aims at correcting frequent or significant mistakes most of the time. You can classify according to the breadth, either it is formative or summative. And lastly, according to the delivery models. Before we actually go into the models themselves, which we're going to do in a few minutes, we need to talk about how the learner would perceive the feedback and what determines that. 3 things determines how the learner would perceive a feedback. The first one, is it true or not? Is it objective or not? If it is subjective opinion, the learner will shut down. And the reason is they will think this is not true, this is false. One of the things actually we do in simulation is that we use video recording, because a lot of the times after the simulation, the team who's been involved in the simulation don't remember that they've done something. So we use the video recording, say like, right, you said this, and they will say like, oh, actually, I didn't say that. I will say like, actually, it is, you said it, but you didn't notice it. So you have to have an evidence, you have to collect information, you have to be objective. Also, the relation with the feedback provider. So, for example, if I'm asking a feedback from someone I don't have respect to, I think they are actually fraud, I don't like, that will again determine how I'm going to receive the feedback, which mostly is going to be, oh, this is not true feedback. On the opposite, if I have respect to the feedback provider, if I think he or she is my role model, okay, my receiving of the feedback from him or her will mean a lot to me. Lastly, does it threatens the learner's identity? That means the feedback that I'm providing, does it shake kind of a moral or a very concrete concept in that learner's identity? That's why we have to be very careful when we provide the feedback, in order not to do that, in order not to let that happen. Because if it happens again, the learner will shut down and will not accept the feedback from you. So going to the models, there are again different models of providing the feedback. I remember back in maybe 2007, 2008, when I had or attended my first ALS course, the sandwich model was very, very popular. And the sandwich model, basically, you are trying to sandwich the bad between two layers of good. So you start with, you've done this well, that, and that, but you could have improved in 1, 2, and 3. However, you've done 4, 5, and 6 well. So you're trying to sandwich the bad between two goods. Again, that has been proven to be a poor model of providing feedback, and the learners don't actually accept it very well. And that took us to the Pendleton model, which is I think the base of all current feedback models and debrief models. So basically, the Pendleton model relies more on the experience from the learners. So what they've felt, what positive they've taken out from that experience, and they built on it, going to or shifting to the weaknesses and trying to build on how to improve it. You can use ask, tell, ask model, which is a very good way of doing it, by asking the learner about their opinion, about the action, about the situation, and then you tell them about your objective opinion and then how to improve. And lastly, asking about their opinion about that discussion and whether they agree on the points that you've kind of presented to them, and decide on where to go from there. And there is a nice video on the Virginia Upgar Academy of Medical Educators. If you can go to the website later on and have a look at it, it's very, very good. Lastly, or the last model I'm going to present today, is the ABCDE model, which I like because it is very thorough and descriptive of the feedback process. So to start with, allow self-assessment by the learner. Allow the learner to assess their performance and assess the situation. How did they feel about it? How did they see other people's reacting to it? Then be objective in your debrief. Be objective in your feedback. Describe behavior or actions. Don't give opinions. Then you coach them. You tell them your personal view about the whole situation and how they actually can improve. And have that discussion. It is two-way communication. Have that discussion with them. Seek their approval about what you are saying and see if actually they agree with you. Look at what needs improving and how you can change it. Direction comes after that. Where to go, how we can improve, what tools do we need to improve, and decide on the goals for the next kind of when they've been faced with the same situation or they're doing the action again. Lastly, provide their safety net, provide the support, provide the encouragement, and be open for them to come back to you again and say, actually, it's not working. What can we do? Going from there, we talk about do's. When you are giving your feedback, it is essential to choose the right time and place wisely. You can't be doing it in the middle of doing something big. You can't be doing it in the middle of intubating a patient, for example, or dealing with a sick patient. You have to dedicate time and you have to dedicate a quiet place to do it. The sooner you do it, the better after the situation. Why? The more time you give after the situation, the less impact the feedback will have on the learner. Distinguish between facts and opinions. Be objective. Try not to be subjective. Collect data. Either you write it down or use a video, as we said, like the video recording to present your evidence, but you have to be objective, to look at actions, to look at behaviors. Discover through inquiry. Why did you do that? How did you feel about it when you've done it? I saw that you are actually very anxious. Why was the reason behind that? So ask questions that will actually give you more information about how the learner felt and how they are perceived the whole situation. Make it learner-centered. Understand that what works for you doesn't necessarily work for others. We are different. If we looked at the back social styles, we are different. The way you are thinking, the way you are perceiving things might be completely different from your learner. So it is about the learner, it's not about you. Be specific, don't be generalized. Don't be, oh, good work. What's the point? So where can I improve? Or bad work. What do you mean by bad work? What can I improve in there? Oh, your presentation was very poor. Why? How can I improve it? So very, very specific targets and goals. It is a two-way communication. You can't sit down for 10 minutes talking to the learner. It is a two-way communication. You talk, you present what you need to present to the learner, and they reply back, and you reflect both on it. Use counterfactual thinking. So if, for example, if the learner's done something, you present them with another scenario. So say like, if you've done it this way, what do you think about, that your actions, if you've done it a different way, what do you think about the outcome? Would it be different? Would it be the same? And you present them with this counterfactual kind of thinking. You can use the situation behavior impact tool. So when you describe the situation to the learner and you describe the behavior, ask them about the impact they think that had on the team or on the situation. And that reinforces the idea that you are trying to deliver. Don't underestimate the importance of feedback. It is important. You can get someone very high up, you can get them forward, and you can get them backwards. And it all depends on your feedback. Don't be general. Don't be brief. What's good job? What's perfect? What's well done? What's carry on? They are very general. We need something specific. Don't delay the feedback, as we said. Don't force it. Oh, today I'm going to give you feedback. No, don't force it. Unless they ask for it, don't give it. You can say, would you like a feedback? And they will, yeah, actually, I would like a feedback. So you can ask nicely, but you cannot force it. Again, in proper setting, not paying attention, as we said. Use assumptions and opinions as facts. Oh, I've seen you, you're anxious and worried and you're nervous. Don't use that. You are assuming that they were like that. But you say that, oh, I thought, or I've noticed that you were anxious. Is that right? And they will either acknowledge it and say, yes, actually, I was anxious, and say 1, 2, 3, 4. Okay, or actually, no, this is how I am. Don't blame. Don't undermine. You're lazy. You don't care about your patients. That will actually shut down the learner, and it's not professional. Again, don't shut down the learner's emotions. A lot of the situations, you will have a lot of emotions to express. The learners have a lot of emotions to express. Don't shut it down. Don't say, let's set the emotions aside. No, it is important to discuss these emotions because it's a part of the learning. And lastly, don't make it about you. It is about the learners, not you. This is a very nice article. It is a bit old now, but it is a very nice article published in Medical Teacher. 12 tips for giving feedback effectively in the clinical environment. So, in summary, feedback is essential for all of us, the seniors and the juniors. It will maximize our potentials and get us to move forward. We have to understand ourselves so that we can understand others. We have to understand ourselves so we can receive feedback and deliver as well. Remember, evaluation and coaching are parts of the feedback. They are not the only parts of feedback. They're just parts of the feedback. You have to choose the right time and place. Be specific, be objective, be clear. Be supportive, provide that safety net. And lastly, reflect on your own feedback process and see if actually you need to improve on it, because it is a learning experience, and you will have, when you need a lot of experience in providing feedback in order to master it, it is a skill at the end of the day. I'm not sure whether this video will work or not, but let me try. It is Sir Lancelot, if you are familiar with that movie, and it is him giving feedback. So let me just see if that would work or not. I'm not sure. Can you see that? Can you see the video? Yeah? Yeah, I think so. Brilliant. Can you see the video now, yeah?
Yes, now come, Dr. Mohamed, yes.
Brilliant, okay. Is the sound on?
No, it's on. It's not.
Oh, sorry.
I think the sound needs to go up a little bit, Dr. Mohamed.
Okay, right. So I don't want to waste more of your time, but you can. It is doctor in distress. You call that an incision. You Google it in YouTube. Basically, Sir Lancelot here is giving a feedback to the surgeon about how to do surgery, and it is everything against what we've said tonight. So it is a very nice way to actually reinforce the idea of not doing something. So I'm not gonna waste more of your time. So if you can YouTube it, the doctor in distress, you call that an incision. So that brings me to the end of my presentation. I'm happy to take questions.
Thank you, Dr. Mohamed Elriedy. As you said in the beginning, feedback is an endless topic. I really understand that now, that feedback is exactly how to know the blind spots of yourself. And I like the 4 boxes which were saying what you think, what other things, and the opposite, and the importance of the feedback to know your blind spots, and also how to choose the right time and the right place, and how to be supportive, and all this. Thanks a lot. And is there any questions? I think
yeah, I think there are two questions. Yeah. So the first one, is there a checklist for achievement of fair feedback? I think you may look at the literature and you may find some articles giving you a checklist. The article that I've mentioned in my presentation is a very good article about giving feedback, but I don't think there is a checklist as such. And the reason is, as I said, it's all learners centered. So the checklist would differ according to the learner. So when you are giving your feedback, you have to try to be specific about what the learner wants, and to have this conversation before. So when the learner comes to you and say like, oh, can you give me feedback about something today? Yes. What do you want to know? I say, oh, how to improve myself in this. And that gives you an idea about actually what you're going to observe. So it's very important to have this conversation with the learner. The second question is, what about feedback from junior to senior? Oh, this is actually a good question. So it is tricky, and it is not easy, definitely, for two reasons. The first one is the experience of the junior. Is the junior experiencing delivering feedback or not? This is the first one. The second one is culture. In some cultures, in some countries, it is difficult. The juniors are not allowed to give feedback to the senior, which is not right. You have to be allowed to do that. However, has the senior requested the feedback or not? You have to differentiate between two things. You have to differentiate between someone requesting feedback to improve and something that you've seen that is wrong, and you need to discuss it with that senior person. And they are different because the person who's requesting a feedback, if it is a senior, they are actually asking on ways to improve the performance, okay? So, for example, when you give a presentation, okay, and you are a senior person and the audience are juniors, you ask for feedback at the end of the presentation because basically you want to know how to improve your presentation and how to make it better next time. But it is different when you're working with someone senior and you see something that you think, oh, actually, that is not the best practice, or this is not the policy, or this is not the guidelines. You have to approach that differently. And there are different ways, again, beyond the scope of this presentation, to approach that differently, but they are different.
I have one question, Dr. Mohamed, if you don't mind.
Yeah, sure.
I don't know if it is in the scope of the topic or not, but the last question you answered, I have one question similar to it. It's a little bit common in the interviews. If you are working and you feel, if you are a surgeon or if you are an anesthetist and you notice that your consultant is doing something against the guidelines, what would be the appropriate management at that time? This could be as a feedback, or it is not feedback.
So this is very important. I wouldn't say that this is feedback as such. You are acting on the patient's best interest, and you are acting because you're concerned about the practice of that person you are seeing. So this is not a feedback. What you are trying to achieve here, you have seen a risk, okay? And you are trying to manage the risk. And this is a big, massive topic in the healthcare, which is risk management. But the first thing you would do is that you actually approach that person and inquire. So, for example, I've seen someone giving a certain drug to the patient. And I think, oh, this is not the right drug. I would go and say, oh, Dr. So-and-so, are you sure you want to give this drug to this patient? And so I'll mention the drug. So, for example, are you sure you want to give comoxiclav to this patient? And I will mention why. He was allergic to penicillin. Okay, so you are inquiring and you are putting the evidence why you don't want them to do that. Okay, if it is something against the guidelines, for example, okay, Dr. So-and-so, are you sure you want to do this? Because I've read in the guidelines that we shouldn't do it. So you're again inquiring nicely. Okay, if Dr. So-and-so said, oh, no, I'm doing it because 1, 2, and 3, and 4, and he or she gives you reasonable, basically rationale for what they're doing it, and you're accepting that, you say, okay, thank you very much, I agree. Okay, if they have said, oh, actually, I forgot, thank you very much for reminding me. So it can be like that. Okay, so that you are, again, one of the barriers that can block a mistake from happening. Okay, and if you are aware of the Swiss cheese model, so you are one of these Swiss cheese, hopefully with no holes. The last scenario is that when you say something like that and he or she says, no, I know what I'm doing, get away. This is when actually mistakes happen. Okay, so you need to reinforce your message by saying, I think you're wrong because 1, 2, and 3, and 4. And if he or she still insists on doing it, you need to involve someone more senior. Okay, because you, first of all, you inquired, okay, then you presented your actually kind of contradictory message. Okay, and lastly, okay, you are trying to save the patient. If they still insist and they are just about to inject, and and you need to get someone senior, if you are senior enough to say, actually stop, okay, and actually, for example, in theaters, the nurses have got this power, and the surgeons and the more senior people in theaters, they have to empower other professionals within that environment to actually help them to stop any mistakes from happening, because at the end of the day, the patient safety is your priority. Okay, if you are in that position where you can actually say, actually, I'd like you to stop and leave the room, okay, you can say it, because at the end of the day, you are acting in the patient's best interest. But this is kind of a bit tricky, and again, as I said, it is different from feedback. Feedback has to be requested. Feedback has to be asked for. You cannot enforce it on someone. I hope that answered your question.
Yeah, thank you very much, really.